Many people blush when they're excited or embarrassed, but if you have persistent facial flushing, you may be showing one of the symptoms of a common skin condition called rosacea. April is Rosacea Awareness Month, so joining us to discuss this, Dermatologist Dr. Davindra Singh. Good to have you in to talk about this. So tell us what exactly it is, because it's just not about blushing.
No, so rosacea is a chronic skin condition where usually it starts with redness and flushing in the central face, but then it can morph into other types of variants.
So when you say flushing, is it something that just kind of happens and then disappears again?
Yeah,
or is it...
Yeah, it kind of comes and goes, and there's triggers that can cause it. So people know about red wine, alcohol,
right,
hot liquids, spicy foods, caffeine, emotion, stress. These are the things that can cause you to flush, and then it goes away. But over time, the redness becomes persistent, so you have rosy cheeks like permanently.
What do we know about rosacea in terms of some people getting it and some people not?
Yeah, so we don't really know what causes it. That's the problem. So there's lots of theories. People have talked about hormones, sun exposure, the immune system, bacteria. And lately we're talking about a Demodex mite. It's a mite that lives on our skin and the hair follicles. Now, yeah, I know. But we don't know if it causes it. We just know that in rosacea sufferers, you have more of those mites. So it's a target of treatment.
When we talk about chronic rosacea, in terms of the skin, is it, I mean, tell me about, can you actually see, veins as a result of that?
Yeah, so there's 4 types of rosacea, and that's what people don't know. So the first one is when you get the redness and flushing. And those people often get little veins in their cheeks, and they often have sensitive skin. And that's more common in women. And the second type is when you get bumps and pimples, like this type here on the picture.
Yeah.
So it looks like acne, but it's a little different because there's redness around it, and we have to be able to determine which is which. The third type is when you get it in the eyes. It's called ocular. Yeah, you can get it in the eyes. It's called ocular rosacea, and you can't really see it so much, but it kind of looks, or it feels like a gritty sensation, and sometimes you can get inflammation of the eyelids.
Oh boy. And
then the fourth type is the one everyone's scared of. That's when we get the big fat nose.
Yeah, okay, and what's that as a result of? Because we're taking a look at this picture here.
Yeah, so this is a result of overactive oil glands. So the nose can become, like this one here, for example, it can be quite large, bulbous, and there's lots of oil glands there.
Will it go back to normal? Like, can you fix that?
You can only fix this
I'm not talking plastic surgery. What I mean is, with treatment.
Well, treatment doesn't really, the only way to get rid of that is to actually go for surgery.
Oh boy.
Yeah, but not everybody gets that.
Tell me about common, treatments, I guess, for rosacea.
So, because you have to identify which type it is, so the bumps and pimples are easy to treat, and so is the ocular rosacea in the eyes. Those respond to antibiotics and creams.
Okay.
The big fat nose is usually a surgical one, and the one that's the hardest one to treat is the one where you get redness and flushing, because that often only responds well to laser.
And laser will do what? Does it?
So laser is like shining a flashlight on your skin, and it targets the blood, so it heats it up, and it kind of sticks the blood vessel wall together. So it kind of eliminates the blood vessel, so it reduces the redness.
So once you have the treatment, and let's say, you're lucky and the treatment works, can it come back?
Well, this is the problem. So rosacea usually starts in adulthood, in the 30s to 50s. You're actually the person that usually gets it. People of Eastern European descent versus Indians or Asians. But it kind of starts to evolve, and then eventually it plateaus. We don't have a ton of people in the nursing home with rosacea, so at some point it starts to plateau, but we just don't know when. It's kind of an individual thing.
And it would seem that, is this something, because, like, exacerbated by sun, or is it something that, it's of modern times?
Well,
but not necessarily.
No, it's not of modern times, because if you ever go to the Louvre, for example, there's this painting. It's called An Old Man and His Grandson, and the man is portrayed with a big bulbous nose, the big fat nose we're talking about.
There's this painting, and this is in the Louvre.
That's in the Louvre. It's beside the Mona Lisa, so I get attracted to this where everybody else goes
to the Mona Lisa, and you go to this one?
Yeah, I go to this one. But this is from 1480.
Wow.
So it's been around for a long time.
So he's had that condition. Of course, dermatologists would have recognized that for that painting, for doing that.
We might have helped him. Yeah.
Wow. All right. Well, it was fascinating, Doctor. Thank you for coming in.
Thanks so much, Viv. Pleasure.